Well, welcome everyone to the 27th Degree with Chris and Nancy, brought to you by 27 Degrees Consulting. Today, we're really pleased to have a special guest, Dr. Rajiv Nehra. But before I get into you and what you do and all that, I just want to make a sponsor recognition for Bay Coast Bank. Bay Coast Bank is just right for all of your banking needs. Visit baycoastbank.com or call 508-678-7641 to learn more. So now, Dr. Nehra. What?
We have a new Patreon subscriber.
Oh, yes, okay. So Nancy, poor Raji's waiting here.
No, I'm
okay.
blessed to
Nancy,
be
go
here.
ahead.
We're going to spend a lot of time with Raj. But yes, we have a new Patreon subscriber. Shout out to John Medeiros. Thank you very much. For those of you listening, if you want to become one of our Patreon subscribers, you can click the links on any of our social media sites, and the little patron perks you get with that are chat sessions with us and exclusive behind the scene conversations and a free business consultation with Chris and I.
Great.
Over to you.
Yeah, it's exciting. It really is. All right, so Dr. Nehra.
Yes,
Dr.
thank you
Nehra,
for having me. Yes.
I have known Dr. Nehra for many years.
We go back
Over,
sometime.
I don't know, 21, 22 years or
Correct.
so. A
Yes,
long time.
we have.
We're going to age ourselves or date ourselves by saying that. But he's a well-esteemed, regarded chiropractor. And we thought it would be great just to talk about chiropractic care. I think there's a lot of people out there who just don't really know what chiropractors do. So first, tell us a little bit about yourself and your training.
Yes, well, thank you both for having me here. I really appreciate this opportunity to kind of educate our community in that chiropractic is a viable resource to better manage some of the concerns you may have, I guess, with regards to your health. I mean, for the most part, people think of situations where they may have neck pain or mid back pain or low back pain, and they may not have typically responded by conventional care, whether that's utilizing over-the-counter NSAIDs or icing down or whatever home remedies they may have thought of, and they may speak to their doctor, or they may know of someone that has been to a chiropractor in the past, and they say, let's see if this is a viable opportunity to provide some relief, to provide some recovery. So I've been fortunate. I've been in the community of Fall River for almost 23 years, so I've really been blessed. I was in the Hanover for the first 20 years, and now I'm right across from the new Durfee High School, which is
nice location.
It's really nice.
Yeah.
And really been blessed that we've been here for 21 years. Fall River is wonderful. The people of Fall River are wonderful in the community, and we've forged some nice relationships with physicians to say, hey, look, maybe you can try this resource of care and see if you can get them some relief and some benefit. Yeah.
Dr. Nehra, how does a person know they need to see a chiropractor? Maybe I threw out my back or something, and I'm thinking it's going to be better by the end of the week, or maybe I twisted my neck, or at what point should I be thinking?
That's exactly when it is. And I would say in most cases, within a couple of days, you just get better. And that's what we want to have happen. But in those cases in which you do have some lingering pain, you're having lingering symptoms, or unfortunately, if you feel like your symptoms are increasing in its quality, where you just had some, throbbing, and now you're starting to get some numbing sensations or some weakness or pins and needles, that's the time in which you want to have some conversation, whether it's with your primary care doctor or, calling the chiropractor and seeing if they can better navigate the outcomes that we need to get at. So they can talk to their primary care doctor. The primary care doctor will suggest some opportunity, but in conjunction with the fact that you're not responding, you're not getting better, the longer you let that leak go on, the bigger the puddle will happen. So you want to get it taken. You want to take care of it, and then it's harder to clean that spot up. I mean, so for me, I always try to educate the patient to be as proactive as possible in the initial signs of those symptoms. And we all have weekend warriors, and that's a different quality and class of patient.
Sure.
But then when we talk about some neurological implications, that's when you really want to utilize some professional help through your primary and certainly into the chiropractic realm into obtaining the right workup, obtaining the right examination, and then from there, utilizing avenues to get that disc healed, to get that soft tissue less spastic or less hypertonic, which means they're tight, they're rigid. And that's the body's
spasm,
reaction.
yeah, right,
Spasms.
right.
And that's the reaction to injury. And we don't want that.
So now, if I went to Disney, and this actually did happen to me,
Okay.
I went to Disney like when the kids were little years ago, and I went down that big water slide, and my neck was like, I think I just ruined it.
Yeah.
You know?
Yeah.
So like I get home, I'm still sore, it's not going away. I call you. What are you doing for an initial workup with me?
So certainly we're going to understand the mechanism of injury. So, it's not a severe trauma, but we talk about microscopic acute trauma. I'm not saying let's turn your head the wrong way or twist your back the wrong way or just shoveling. But in that case, I would define it as some micro trauma that you sustained. And even within that realm, you do need some conservative workup. You do need some conservative treatment, in which what would I do? I would examine you. I would kind of check your range of motion. I would do some orthopedic tests. And then we would start with some soft, gentle, delicate treatment to allow the body to navigate that body's natural process of recovery. All chiropractic care is a facilitator to allow your body's natural processes of healing. It's not a substitute for anything. It's just providing a better roadmap to say, we get a paper cut, the blood clots, it heals, so our body has that inherent innate power to heal. So we're just that tool to help it in a, more efficient, more effective, and hopefully in a quicker manner. And it doesn't come back. Like you've heard people say, ever since that trauma, I've never been the same.
I was one of those people. So
Yeah.
I still am one of those
You
people.
still have neck pain, really?
Well, if I aggravate, like it's that same pain that comes back. It seems like if I do something that he's looking at me like I'm a liar.
No. That not to cut you off. That's so true. People do get better because that's a
Yeah.
natural reaction, but they're never quite the same.
Yes.
And that's what we call like scar tissue or recurrent adhesions or fibrosis, which basically means, when the body repairs, it's not with the pure tissue as we're born with, it's with slightly compromised tissue. It allows you to function,
Right.
but it's never quite the same.
I see.
But when you get the proper treatment and then the follow-up, whether it's the exercises I recommend or the ergonomic awareness or certain behaviors, spinal behaviors, postural behaviors, that ensures that in your 50s,
Right.
60s, 70s, those repercussions that you sustain from Disney doesn't make you aware what
Yeah.
happened on,
Yeah.
Space Mountain, because now it's
What was
catching
it,
up
the
to me.
Splash Mountain? Or?
No, it was
Splash
at the
Mountain.
water park. It was one of those big, tall skyscraper slides that I just don't
Probably
know
like a
why I
10-foot
did
drop.
Yeah.
that. It had to be at least 12. At least
But
12.
to your point, we are a delicate machine, and if we look at science, it really doesn't take much to injure the disc. It doesn't
Right.
take much to injure the supportive spinal ligamentous, tendinosus, soft tissues. So, yeah, I mean, going down, the roller coaster. There's a warning that if
Right.
you have chronic low back pain,
So,
this is not what's meant.
it's interesting. You say, like, it doesn't take much to injure a disc. We always think of these real abrupt injuries that occur, but a lot of this stuff can be, you work at a desk all day looking at a computer with your head in this
Right.
position, and you've done that for 20 years.
Yeah.
So we understand pain as water over the dam. But the reality is the water over the dam is not the problem. The rising river is the problem. We're just on the other side of the dam, and we don't know that's occurring only until the water's over that dam, and which is like, oh, now I have pain. Now
Right.
I have symptoms.
Right.
But the reality is, again, is that it's been brewing for some time,
Yeah.
and only when you have pain do you do
Right.
something about it. So for me, in my with my patients, intuitively we try to get them out of pain, but moreover we want to educate them to say what you need not to do to come back.
Right.
What can you do so that in your 50s, 60s, and 70s you're not having repercussions? Because we are biped species. We are subject to weight. We are subject to pressure. Nobody's flying, nobody's teleporting themselves. So we're always going to have a negative gravity will always take, precedence on our discs, on our joints, and we call it arthritis. I have gray hair. We can't stop that. But there's things we can do to be proactive for the gray hair and the wrinkles in our bones, in our joints, in our discs, in our spines. And I'm not saying nobody's not going to have disc pain or nobody's going to have joint pain by coming to chiropractic care. But what I am saying is if you can utilize any and all resources of wellness, you can't go wrong. That's my thought.
I mean, I remember it was interesting. I mean, you helped me out with this. I had a neck issue, and I ended up with came on fairly acutely, no injury, some neck pain, and it went down my arm, and it was really, I had some weakness in my arm, and then I ended up having an MRI, and the radiologist called me, and he said, "Oh my God, you need surgery. This is terrible. You've got this terrible disc herniation," and there was no real injury that occurred. It was just probably years and years of, working in a particular way, having my head in a certain position. Who knows? But I knew enough to try to avoid surgery, and I did. And I went to you, and you were able to really help me out, and it got better over a period of time.
So we're not anti-surgery. There's definitely a need. I mean,
no, there's a need.
There's an absolute utter need. But my argument is, if we can provide a treatment that will not make you any worse, and there's the possibility it could actually help you heal that disc, then try it.
Yeah.
Let's not try it for 6 months. Let's not try it for 6 weeks. Let's make an agreement on a certain window in which we can agree to. If there's some relief, if there's some benefit, if there's some positive change, then we're heading in the right direction.
Right.
If not, at our facility, we'll make the right arrangements such that you're in the right path, whether it's certain kinds of medicines to help that healing process. God forbid it's an injection, or certainly in your case, we want to try to avoid the surgery.
Yeah, let me clarify to the audience. I mean, there are times as a doctor I send people to surgery. They have to have surgery. They have, profound neurological deficits, whatever that may be. My arm weakness was pretty mild, and it got better. But, what I have learned over the years is that a lot of this stuff does get better.
The body does heal.
Yeah.
We've all had paper cuts. No one's bled to death.
Right.
So whatever systems stopped us from bleeding death from a paper cut are those same systems that are going to allow the body to heal.
Right.
But sometimes in those sequential series of events, you do need external help.
Right.
Whether it's the modalities that we provide, the adjustments that we provide, the home care management. Drink water, people. Ice it down. Get a good pillow. Watch the way the ergonomics of your computer. It's just
so
an
what you're
education
trying
process.
to do is you're trying to speed up the body's natural healing process, basically, and use chiropractic techniques to get patients to the best ability and function that they can.
That's our goal.
Right.
And that's the part of our examination, our interview. And in the course of our care, it's not just the modalities or the adjustments, it's that educational process that, they have to be somewhat responsible for the outcome that which they desire. You need to, not build a stone wall after you have a disc injury. You need to take precautions. We need to shelf you for a while to allow those systems to heal. Yeah. So you're absolutely right. And if things are going sideways where the neurological deficits are getting worse, then of course, intuitively, as chiropractors, we understand our scope of practice that we may need to bring a neurological evaluation on board. We may need to bring a neurosurgical or an orthopedic evaluation. Or I get X-rays within a day or a visit or two. If 25 years of experience says, let's get an X-ray. Let's see the quality of the alignment. Let's see if there's underlying degenerative changes that may be precipitating your symptoms. Let's get the MRI or some nerve tests to see if there are these deficits that you're talking about.
So you brought up a great point here just about imaging. So when patients come to a chiropractor, if they come to your office specifically, what would they expect to have done? Would they automatically get X-rays, or would they not need them in many instances?
I can only speak for myself and my 25 years of experience in that, for me, it's not just the CAT scan, it's not just the X-ray or the MRI, it's listening to the patient. So if I feel that, the patient has some concerns in which there's any neurological concern, then intuitively, immediately, I would want to get some diagnostics to understand what it is, what it means, and based on what it is and what it means, what's the most appropriate means of management.
Right.
And I start with an X-ray just to see. And you know, X-rays don't tell us only the disc. It doesn't allow us to see the spinal cord. It certainly doesn't allow us to see the nerve, but it does allow us some information as to what it's not. It's not lytic or blastic, meaning, you know, there's nothing eminent going on.
Yeah.
It's not any acute fracture or horrific dislocation.
Or cancer or whatever.
That's what I mean
it may
by
be. Right.
pathology. So it's not those things. And that kind of takes them off the cliff a little bit. It's nothing eminent where you're a candidate for some passive treatment in terms of chiropractic. And God forbid if it doesn't get better, then it allows us to
Right.
take it to the next level, whether it be an MRI or a CAT scan. So for my practice, I would say within the first week or two, approximately 90%, if they're not showing signs of progress, they are getting some diagnostic tests done, just to better rule out any eminent pathology. And another way, a lot of my patients have already tried other resources, so they already have some diagnostic
Sure.
information.
Right.
They've been to
They've been to their primary.
they have
they've
already
been-
had those stuff, and maybe they were scheduled for surgery, or they were scheduled for injections, or maybe they had one injection and said, look, in addition to those things, maybe I can help complement that process. I like to try some of the things that you
Yeah.
do in a very safe, conservative, gentle manner, because I already know there's a pre-existing going on.
So when they're trying the other treatments, is there anything contraindicated with like treatments that don't really mix with what you do?
Well, you know, if
Like injections?
So no, I'm a big proponent of injections.
Okay.
So one of the things I do with disc pathologies, I do a lot of traction, and the theory behind that is you're trying to take the pressure off that
Right.
disc. Your hand is on that jelly donut. The jelly donut is flattening, and that material is squeezing out.
great
So what
analogy.
I'm trying to do is intuitively take the hand off that jelly donut and train you so that hand doesn't come back on.
Right.
So it's ironic where I say, let's do the traction in addition to the injection. And what I'll say is that if you had two twin brothers, one's doing traction and getting the injection, where one is just doing the injection, research tells us that the one who's doing the traction and the injection may get higher
So
outcomes.
they're complementary.
Absolutely.
Do you do injections as
I do
well?
not. I send
Okay.
them to what we call the
So, like-
physiatrist
okay.
Yeah.
or physical medicine.
Okay.
And it's all done under video fluoroscopy. They know exactly where they're going.
Right.
And in order to get that injection, unfortunately, they've had diagnostics. They had to have had an MRI. So if I'm expecting my intuition tells me there's some disc involvement, I'll get the MRI so then I can refer them to the physiatrist so they'll know exactly where the hot spot is, where the hot nerve is, where the hot disc or the spinal cord, God forbid, irritation is. And then we're working together with the conservative chiropractic traction with medicine called the injection to that area. So it's a team approach to get the best outcome, I feel.
So I'm going to compliment you a little bit right now. So one of the things that I've always liked when I've referred patients to you over the last 20-something years is exactly what you said. You look at it as a team approach.
Yes.
So, you know, you don't work in a silo, which is great.
No.
You know, you work with, you know, your internal medicine, family practice colleagues, orthopedic colleagues and whatnot, to work with them to help the patient get better, which is great. And that's, I don't know if, I mean, I think there are other chiropractors, of course, who work that way, but there are others who don't.
That I think you're absolutely right. There are that do work with the same mindset and the same systems that I try to work. You know, a patient may see their primary care physician, they're relatively healthy once every 6 months.
Right.
And in between that time, they hurt their low back and they may come to me. And I said, look, you need some stronger over-the-counter NSAIDs, or you may need a steroidal medication to help complement if they're in pain, it's your duty to say, whether it's chiropractic or therapy, but if you know some medicines will help. So many times I'll call the primary care doctor, say, look, I'm doing my modalities, I'm doing my treatments, but in addition, we need to take the edge off for this patient. We need to help do something. What are your thoughts about some NSAIDs or some steroidal medication or muscle relaxer, whatever the case. So again, the primary care doctor and myself were working cohesively, collectively, just to get them as good as they need to be.
Dr. Nehra, we talked a lot about like diagnostic tests and everything. Can we talk a little bit about costs and what's typically covered by the insurances?
Fortunately, chiropractic is provided by all, if not, most, if not all, insurances. But as Dr. Joncas will attest to, insurances are a little bit changing.
Sure.
Where in some categories we are defined as specialists, to which you have a copay or a specialist copay. So to answer your question, we are covered by all insurances for the most part. In some cases, you do need a referral by your primary care doctor. But ironically, the majority of my patients are referred by their primary care physician. So it's a nice, a nice approach where I'm getting their referrals, and it is covered by insurances.
Yeah.
They may have some stipulations with an amount of visits, but look, if they need the care, I'm going to try to be the best ambassador toward the patient to get the best care they deserve.
Before when you were talking a little bit about treatments, you mentioned ice. And there, like in my mind, I always get confused. Okay, is this ice or is it moist heat? Like
Yes.
ice or
When do you
heat?
ice? When do you heat?
What is that?
That's a great point to bring up.
Yeah.
People
So
ask that
for
question
me,
all the time.
in medical terms, ice is a vasoconstrictor, and it stops the swelling. And when we talk about pain, it's emanating from some source, which is inflammation, edema, and swelling. So for me, in my practice, I'm the biggest proponent. After the treatment, I mandate that they go home and ice down, or at least they try to ice down before bed for at least 10 minutes. But then the argument is, well, heat feels good. Tequila feels good, but it's not necessarily helping you.
Not good for you.
Not good for you. So what we're trying to do is initially stop the swelling. So for those reasons, in the acute phase of care, which is why they're in my practice, it is my professional opinion, ice is most advantageous. And do you do it for 3 days, which, someone may go to the ER and the doctor says, well, just try it for 3 days. But you got to understand, it's microtrauma every day, meaning you have the original injury and then you turn the wrong way. In the process of healing it, you're still re-irritating it. So you want to continuously do ice. And there's precautions I educate them with. Use a thin towel, use a thin t-shirt so you don't get any skin irritation. I tell them the time, frequency, and the duration of when to use ice. And we're all busy. You can't put an ice pack, but if you can do it before bed, rule of thumb, you can't go wrong. We heal at night. We repair at night. We restore at night. So the body replenishes itself at night. So if you're doing ice, your body's a little bit better than not. So that's my statement with regards to the utilizing ice versus heat. Tom Brady throws 50 passes, and on his interview, he has an ice pack. He's not plugged into a heating pad.
Right.
So sports injuries, they're always using ice. And these are acute injuries, even though you may have had chronic low back pain. The reason why you're in your office is because it's been irritated. It's been aggravated. There's some exacerbation. Where for the first few weeks, I always suggest ice.
I like the tequila analogy because it's true. Patients come in all the time and they say that heat makes it feel better.
Yeah.
In the short term.
Right. It makes you feel better, but it's not actually curing the condition to which you're having, which is inflammation, because heat is a vasodilator. It's opening the lymphatics, which is slightly increasing the swelling, which is the thing to which we're trying to mitigate the cause of that swelling. Which is a disc injury, a soft tissue injury, an osseous injury, or arthritic scenarios. So there's a panacopia of conditions that we all experience. I'm not 18-year-old syndrome, I call it. Or it's called gray hair or wrinkle syndrome. It does. I'm not suggesting a cure. I'm just saying, can we improve your quality?
So I've got sorry. Go ahead, Nancy, if you want.
Well, no, I was just going to say with the ice thing, it's important to also know that if you don't have like a legit ice pack at home and you're using those frozen vegetables, that when your 18-year-old son uses frozen vegetables on his neck and falls asleep and the bag of onions goes under his bed, and 2 days later you're wondering what that awful smell is in his room, check for those frozen.
So to your point, there's so much research out there. They did like these studies what's the highest efficacy? A bag of peas and like a bag of ice in a Ziploc, or those blue gel ice pack. I mean, the bag of peas and the blue gel packs has the same outcome. So if you don't have the opportunity to go to CVS and buy $20 ice pack, get some old frozen French fries and put it on your
It's amazing
neck.
that was actually studied.
There's a study, and I think it's funny because we talk about it.
Yeah.
There's $30,000 earmarked for this study. God knows, 20 years back.
awesome.
That wasn't our tax dollars.
No,
was it?
I don't know.
I don't want to get into
I
that.
don't know. Yeah,
Let's not get into that.
So to your point, yes, you can use anything that's available, to try to stop that swelling and edema, whether it's your neck, your mid back, your knee, what have you. Yeah.
So here's a question. This is it might be a hard one, maybe an easy one for you to answer.
Yeah.
I'm not sure, but this comes up all the time, and I'm sure
Sure.
patients wonder this. What's the difference between going to a chiropractor versus going to a physical therapist?
So we adjust patients. I feel that there's a different approach in that we focus on the spine, the osseous component, and we understand that the soft tissue, the ligamentous, the tendinosis works in conjunction, where they do a lot of the rehab, restoring, restructuring, strengthening components. So there's 90% crossover, but they just don't do the manipulations. That's the biggest difference, I would say. We do more of adjustments to the spine and to the extremities more than they do. But you'll be surprised because a lot of physical therapists, they adjust, and
Really?
they had some extra training, and because they know the efficacy behind the adjustments and the
Interesting.
benefits that
I
they do.
actually wasn't aware of
So
that.
I would say majority of them, they adjust they themselves, and there's an actual code for physical therapists doing osseous adjustments. So good for them that we're all, drinking from the same water fountain and hopefully getting the same outcome. So, and to your point, I concurrently refer a lot of patients to physical therapy because I think it's such a critical component to maintaining their global health through their global outcomes. So I refer a lot to physical therapy.
Why? Like, what does physical therapy do in conjunction with you?
Is it
Does
someone who has like muscle weakness you're trying to
Exactly. So
strengthen?
maybe they need a more hands-on approach in the exercises, in the core or the cervical stretching, strengthening, stabilizing component, where the physical therapist can do those things a little bit more time they can spend doing it, where it's not that we're limited with time, but we're focusing more on the spine, where in conjunction we keep their spine aligned, and they can take the opportunity to teach them these exercises.
So you're strengthening those muscles that support the structure, so it's
So
really
it's not compromised,
see.
right?
So you really work together. Then.
We should work together. We should work more together. I personally, again, as a policy at our practice, we do utilize physical therapy, on so many of my patients.
So you really take like a holistic approach.
We try to, and when you're driven by the fact that you're here to serve your patient and you're here to, get the highest outcome for the patient, no matter what resource, whether it's through medicine, through injections, through surgery, or through physical therapy, the patients, they're motivated to get better because you're making that investment in that patient. And patients do get better. I mean, a disc herniation isn't an opportunity to write your obituary. Let's start doing your eulogy yet. You're gonna get better by doing the right things. Not everybody.
No.
But try it. See if some of the things you can do in a safe, non-invasive approach can get the body to heal.
Right. And there's an emergency to getting this stuff taken care of because, we've talked about this before. If someone has pain, it's an acute issue. But then after a period of time, it becomes a chronic issue. And that's a whole different
It's
story.
very hard to treat disc pathology. The rule of thumb is after 6 months.
What's disc pathology?
Meaning like the disc is injured, the disc is dehydrated, the disc is herniated, bulging, protruding, what have you. Meaning, if the sooner you try to manage the pathology, the disc, the higher the outcome.
I feel like that's kind of tricky because I feel like, I hurt myself and I'll just it'll get better in a few days. So am I already outside that window?
No, well, we're talking about like 6 months. For example, if you've got nerve pain that's been going down your arm for 6 months,
Yeah.
we
to follow it.
need to really roll up our sleeves
yeah.
on that.
Yeah.
We have to be really aware of what's going on, and there's tests we can determine. We call it like an EMG NCV test,
Yeah.
which when you have heart, it's EKG or seizure. So likewise, we can test the nerve. We test the strength of the nerve. We test the velocity of the nerve. We test the smoothness, the latency of how that nerve pathway is being transmitted, so we can see if there's any turbulence. How smooth was my flight from here to LA? While I was flying over Chicago, was there a lot of wind in stopping it? Or my speed, was I running out of gas? Or my strength, was I punching like Mike Tyson? So we can determine that, and then the neurologist and myself, with that information, we can determine the severity, and equally important, its location. Is it a C5 or a C6? Or we can know exactly which of the nerves, and that's the area which we want to most focus on. So we can preserve C5 to make sure C4 down the road doesn't get sick as well.
So here's a question. So if someone has Nancy goes to Disney and goes on her little 5-foot water slide and gets an
50.
injury. It wasn't a 50-foot water
Yeah.
slide.
Yeah.
She gets an injury and she has some back pain. How long does she wait? Let's say there's no nerve pain, going down the leg, or weakness, or any of those things we worry about.
Well, culturally speaking, as American culture, I mean, it's your comfort zone. I mean, if you're not getting better, I would advise, 3 to 4 days, you've tried ice.
That's what I was
You've
gonna
tried,
say, too.
at least
Yeah.
make a phone
Yeah.
call
That
to
makes
some
sense.
professional to say, look, this is what's going,
Right.
and they can manage it remotely. Well, why don't you try some Motrin or whatever the case may be, depending on
Right.
your ability to take these medicines.
right.
And then if, within a week to 2 weeks, it's not getting better, it's going sideways, then that's the opportunity to see me. Or, I've educated, being here for 25 years, I may see a patient in 2014, and fortunately they got better. And last week they slightly re-injured, and they know to get in right away to
Right.
say, look, I don't want to wait the 4 or 5 days.
Yeah.
I want to nip it in the bud. I want to be as proactive. Let's put the nails in the coffin of pain, and let me get back to my normalcy of life. And that's
like
what we
that.
only want to do.
Yeah.
So that's with that our cultural understanding. What do we want to try? A holistic approach through chiropractic care. Are we comfortable with the chiropractor? Are we educated to say yes? This is something above and beyond NSAIDs or icing or taking it easy to help your body restore itself, repair
And
itself.
by NSAIDs, just so everyone, I'm sure most people know this, but it's, ibuprofen, naproxen, which is Aleve, all of those things that you get over the counter.
Yes. Yep. And I recommend that, again, with conjunction with their
Yeah.
priming, and I would always ask if there's any other health histories that
Right.
would
Right. And if you're going to take those medications, I would absolutely recommend you speak to your doctor, because they do have effects on blood pressure, kidneys. They have effects on the GI tract, and they're not as benign necessarily as people make them out to be. A lot of these over-the-counter meds, which people consider to be very benign by the fact that they're over-the-counter, really do have potential side effects.
They do. And so to your, Splash Mountain trip, had you been in a situation where you're having so many years of pain, and you're constantly in a situation where every other day you're taking Motrin, I would have a different conversation with you saying, look, there is collateral damage that's going on, to whether it's your kidney or your stomach, or
a good point.
an ulcer.
Right.
Why don't we try this? And if instead of every other day you're taking Motrin, and you're utilizing chiropractic care, and you're putting yourself in a situation where you're just taking it once a week, well, you're
win.
then we win in many avenues.
Yeah. Yeah.
So it's not just cure-based care; it's also increasing quality of life care that certain components of chiropractic care can
Right.
provide, in conjunction with many other things that we hope to educate. Whether it's simply drink more water, exercise, just walk. You know what I mean?
Yeah.
It's going to help your spine. Just
I mean, all that
walk.
stuff helps.
And if it's the chiropractor that tells them, sometimes it's the primary who educates them. It's the physical therapy. There are things that we need for our global health.
So we had a talk one of our last podcasts, or the podcast before, I think it was the last one, we had a whole discussion about obesity.
Yes.
In your practice, do you find that more people have back injuries, have weight issues? I'm curious.
That's a great point because athletes who are Olympians, who are specimens, young people, trauma is trauma. Injury is injuring. Turning the wrong way can do that. Do people with obesity have a higher propensity of low back injuries? There is some correlation with that. Um, and we're very sensitive to those facts. I never, that is not my topic. My topic is more educating them on wellness,
Right.
saying, look, make decisions. And they've heard it. So it's a team approach.
Right.
You're gonna be stuck with this if we don't do something. You know what I mean?
Yeah, I
Nothing
mean-
produces nothing. Something inevitably produces something.
I guess the point I'm getting at is in thinking more and more about one of the last podcasts we had, where we had a really great discussion about American culture and weight issues and all of that. I realized just how it's tied into almost everything.
So unfortunately, yes, there is weight does perpetuate added pressure on the disc. It does change the biomechanics of the natural curves of our spine. So you may be a little bit behind the eight ball with weight, elements of weight and obesity. There is. And against that, that's a little bit of cultural too, because certain components that they may not be as active otherwise than a more active person, that it hinders their outcomes.
So if you're more active and those muscles around your spine and you're are stronger, does that reduce the risk of injury?
It certainly does. I mean, the simplest thing is getting on the elliptical. It naturally produces WD-40 of our bones.
I like
So
that.
if we're on there, if that's only one way to produce WD-40, and that's a controlled activity.
That's a great analogy.
So
I
that's
like that.
that's it. That's it. There's any synthetic way to do it. There's nothing we want to do. So here's the secret sauce to help minimize the progression of arthritis. Walk.
Walk. Yeah.
Just walk.
Walk.
Swim. Elliptical.
Do some type of activity.
That's elbow grease in your joints.
Yeah, that's great.
I'm not anti, taking, rheumatological medications, but we should also say just do those things.
You got to look at the big picture, right? It's a holistic approach, as you mentioned.
I think
So,
they're complementary. I think
Yeah.
allopathic and holistic, and it's heading in that direction. I've really been fortunate to work with so many wonderful primary care doctors and other specialists that they're doing what they do to the best of their ability, and they can say, hey, why don't we try this in addition to that, as long as they know we will bring no harm to thy patient.
Right.
And together,
Right.
again, that team approach, always be an advocate for that patient and mitigate any harm to that patient.
It's interesting. When I went to medical school, which was a long time ago now, unfortunately, they didn't really train us at all about physical therapy or about chiropractic or any of these other modalities of care. So I learned that when I came into practice, and I was fortunate enough to meet folks like yourself who
Yes.
educated me and whatnot, and physical therapists who educated me on what they did. But
I do think times are changing.
I hope it's changed.
I
I
think
hope
times,
so.
like, young medical graduates, they're more open to it. Not
Yeah.
to say people who are more seasoned in the career are not open to it, but I think that there is a level of awareness that I guess patients are kind of pushing them to that end.
Sure,
because
I
they
think
may be
you're
a little
right.
bit disgruntled to say, I don't want medication. I want something else, or
Right.
I don't want this. Is there anything else that you may suggest? And they can say, hey, look, I've worked with Dr. Nehra before. We've had some mutual patients. And let's give it a try. I
Right.
know he's going to treat you conservatively. And if he doesn't, we'll together do the right things to get you where you need to be. So I think the mindset is changing a little bit, and I'm happy about that. I think everybody benefits. The primary care doctors' patients are getting better. I have the opportunity to treat them the way that I do, and ultimately the patient has a better tomorrow than today.
Patients are so much more educated now too. They get on the internet, they come in with, this is what I've read, and that's useful in many instances.
is,
It can be
yeah.
a little bit daunting sometimes, because sometimes you read something on the internet and you immediately think you have
WebMD.
cancer.
Yeah.
WebMD, it's always
So
cancer.
I'm very
but-
cautious. I try to
But it's scary.
mitigate that.
It's scary.
I call it panic search. Minimize. I say you trust in me and your
Yeah.
primary or the specialist. We've told you what you need to know. I mean, you want to be as educated as
Yeah.
you can, but don't do these panic search where
Yeah.
you have a stomach irritation and God forbid it's
You're on your way to the mark.
that's
Well,
not always-
I think the problem when you do an online search like that, even if you're looking at side effects of medications, in general, you don't get a sense of, how common those side effects are. They just give you a list of things.
Yeah.
And so, that's where someone who is trained has a better sense and who has experience. I've seen 1,000 people with this condition, and this is the percentage that will have this.
The
X, Y, and
patient's
Z.
ability to have trust in their
Right.
provider, their physician, they're providing all the information that they need to know for now, and then they can be,
Yeah.
look some information up, but don't do any panic search. Don't
Exactly. Don't get
Yeah.
nervous.
Yeah.
Go to a professional.
Yes.
So,
Dr. Nehra, what are the most common conditions that you treat?
I do treat a lot of soft tissue injuries, which you would call like sprain strains.
Yeah.
Someone's gardening, they're twisting, they're putting stuff in the wheelbarrow, and they hurt their low back. They may not have gotten better in a couple
Yeah.
days. They're starting to feel a little twinge, little sprain strain.
Yeah.
That is a good percentage of our patient base. And then for me, it's just you find your niche. I do treat a lot of disc pathologies, but
Okay.
for the record, if it's of an eminent need,
Yeah.
I'll read the MRI and I'll say, look, this is not necessarily a chiropractic case. Have you had the opportunity to see the neurosurgeon or the neurologist or the
Right.
specialist? So for me, I do treat a lot of patients with disc pathologies, and some get better, some don't. But if they do need the injection, if they do need the surgery, at least they've tried something to say, okay, look, I was on the fence. I didn't respond, God forbid.
Yeah.
I know I need XYZ. Now I know I need the surgery because I can't live like this. I tried traction. I tried stretching.
Right.
I've tried physical
Nothing's
therapy.
working.
It didn't work. I need the surgery. Or some people with scheduled surgery got better, and they're very fortunate and blessed that
Nice.
I was part of the process of recovery.
Right.
Very good.
And there are a lot of people in that scenario, and I'm not here to say, why didn't you try chiropractic before the opportunity
Right,
to be
right.
introduced to surgery? Why didn't I? You're here now. Let's do what we can to do the best we can for the here and the now.
what would be someone that you would see that you'd say, absolutely, you have to have a neurosurgical consultation, and this is not really something I'm going to take care of?
Any time where I read an MRI where the disc is such it's coming in gross contact with the spinal cord or an exiting nerve root. And here's the best part. Sometimes they do see the neurosurgeon and they say, look, right now, we're not necessarily a surgical candidate because maybe the examination didn't
Right.
warrant such. Maybe they said we're not that eminent. Go back to Dr. Nehra, try that for a little bit,
Right.
and you may actually get better through that resource. So what better to have a compliant patient where I send him to the surgeon, they saw the surgeon, he didn't feel it being necessary at this moment in time, and he said, maybe I'll follow up in 3 months, maybe I'll follow up in
Yeah.
2
And
weeks.
That's a great conversation for the
whatever.
patient to be involved
But
in.
and in that time, I gave him some homework to do,
Right.
see the surgeon, so to answer your point is, any time there's any spinal cord, what we call thecal sac, your cord sits in a sock.
Yeah.
So where the disc material is hitting that sock, where the cord sits in, that's the time you want it. It's beyond sprain strain. It's beyond normal
Yeah.
disc irritation and inflammation.
Someone has, say, for example, weakness in a leg and back pain. That would be obviously another issue.
So if they're having that, they've probably already seen someone, but yes, I would. There's a condition called cardiac syndrome. That's hands
bowel,
off.
bladder issues.
Change in bowel and bladder if there's a foot job. So during my examination, and you'll be surprised that right away, within 10 to 15 minutes of my conversation, my interview, or my examination, we'll stop it. I'll suggest what I'm doing, and my front office will make the arrangements where we'll set them right away with the specialist.
Very good.
Disc pathologies, you don't really want to mitigate. You do need a second opinion on that via the neurologist or the neurosurgeon. And
So-
many times I'll have a conversation with the neurosurgeon. It's like, I have patient X. I'm a little bit concerned.
Right.
And they'll try to get him in as soon as possible per my phone call.
Now, for the conditions that you treat frequently, what's the cadence of visits? Like, do I see you 2 times a week?
So
3 times a week?
every condition is different. Every case is different. But if it's in acute care, God forbid you were involved in some sort of trauma.
Right.
Let's say you fell down a flight of stairs and, I'm not wishing this on anybody, and they injured their
He
neck.
was talking to you.
So
I know he was.
initially I want to try to be as aggressive as possible. So that's where we're at. If they can get in and do the homework, that's what we want. Get them in, get them better, and teach them what they need to do not to come back. But nobody can prevent a falling down the stairs.
Right.
To answer your question, I want to be as aggressive I can initially.
Yeah.
If it's every day, there are patients who are in writhing pain. I'll see them twice a day. You're taking 2 Motrins, you're taking 3 Motrins. If that's synthetic anti-inflammatory, the modalities, the therapies,
Right.
the treatments are natural anti-inflammatory.
Yeah.
So there are many patients who are in a lot of pain. I'll see them twice a day. So depending on the condition, if it's a chronic arthritic, I may see them once a month, or if they're a construction worker
Yeah.
that works in Boston and they leave Fall River at 5 o'clock and they only come back at 5 o'clock.
Right.
So I'll see them one Saturday once a month.
Yeah.
Not because it's just that they're in pain or they have symptoms or in their discomfort, because they understand the nature of the work I do. I want to do that all I can be so it doesn't catch up to me in my later life.
Right.
Yeah.
So every condition's a little bit different, but for your acute care, I like to try to educate the patient. Let's get you in, let's get you better, and let's get you on the road to recovery.
Can you explain to our audience what an adjustment looks like? I mean, what's that?
Yeah.
I mean, there's different ways of doing it.
There are different ways of doing it. So for me, the patient will be lying on their stomach. We say prone. And I'm just, it's like pressing it in warm butter. That's the feel we're trying to get to. And we just try to introduce some energy, some force. And even in its subtlety, you'll hear a little bit audible. You'll hear a little bit release. And in most cases, patients, it's almost like getting the dental floss and getting that piece of popcorn that's been stuck in there for so long. And
Right.
you're aware of it. So when I get that dental floss in there and kind of loosen them up, break up that tension, that tightness, that spasms, they feel great. Or we do a lot of stretching. They're lying on their stomach, and the table's designed where the table drops and you're opening it up. You're allowing air in that system. I'm being very metaphoric, but you're allowing blood flow, and with blood comes food, fuel, nutrients to help heal, repair some of those damaged tissues.
Does it hurt?
I'm so glad that you said that, because when adjustments, I typically think of the, and it's like,
There are adjustments of that like. I personally am not an aggressive adjuster. Can't speak in my entire profession. And, I've seen the YouTube videos and I cringe. So for me, I'm the polar opposite. I rather never help you than hurt you. I'd rather you walk out the door saying I'm exactly the same than in be in any duress, or I don't
Yeah.
want to derail anybody.
That's
But
so
what does it
good.
feel like? I mean,
Yeah,
most
does it hurt?
patients feel good that I got that popcorn out, I'm loosening them up. And are there
it
occasions?
seems like very gentle.
I have a tendency to be on the gentle side. Do people experience a different reaction? There are. They're in a lot of acute pain. We're creating change. So when your child went to the orthodontist and he tightened up the
Yeah.
braces, they're sore, they're raw, they're tender, but it's still a positive event. So once they get
getting
over
you
it
where you
after a
wanna
day or
be.
two, then it's still, you're making a positive motion, though you may experience an initial negative reaction. When you get your teeth cleaned, you bleed, you're sore, you're raw, but the next day a
Yeah.
positive event has occurred. And that way your spine may be all cattywampus for so long,
Yeah.
and that's its new norm. And I'm trying to evoke a positive change.
So-
Cattywampus, isn't
Yeah, I
that like
like
a
that.
Midwestern term?
Right.
Where did that come
I'm just
from?
gonna go
I'm
with
from
that.
Iowa.
So just to understand, so when you adjust someone, and I know there's other things you do other than adjustments, but when you adjust someone, the theory behind that is it's not just alignment of the spine, right? It's increasing blood flow, affecting inflammation,
Decreasing inflammation. Absolutely. You're creating realignment. Look, when the axle is bent, it's going to affect all performance of that vehicle. It accelerates wear and tear on the tire.
Mm-hmm.
You can't propel accordingly. So if the axle is straight, then the tire and the engine in the car, they perform a little bit better. So an argument is when the body is designed, it functions as its designated design. So
Okay.
that's what we hope to evoke, is just mitigate any deviation and thus allow the body to function as designed.
But so you do that. There's other things you do. I mean, you work in a very holistic way. You do some disc decompression. You have a machine I know that does that.
We do that. It's phenomenal. I mean,
Yep.
people need to understand there are alternatives than suffering. How about I put it that?
Yep.
And I believe, taking hand off your jelly donut is stopping the jelly from leaking on that white silk tablecloth. There's no other way to say that.
Right.
Yeah.
So
right.
for those reasons, absolutely. We utilize stimulation to synthetically strengthen the weakened, the injured soft tissue. It would be, these electrodes, and
Like
it's
TENS.
just TENS.
Yeah.
A little different outcome, but yes, exactly like your home TENS units. And we do ultrasound, and what sound does is it realigns the injured tissues. When the tissues are injured, they're in chaos. So when they're matrix, when they're all realigned, that's how they're designed. It increases blood to that area with the ultrasound. Nutrients come, so it perpetuates a faster reaction and healing for those injured, damaged soft tissues and bone structures.
Interesting.
So the patient has the opportunity, and now there are some contraindications to utilizing. God forbid if you have a pacemaker
Sure.
or a certain bone quality or age. So there are things we don't do.
What about pregnant women?
So ironically, we have a huge patient base of pregnant women. We have a lot of local OBGYNs that send their pregnant patients our way for the simple fact they can't do anything other than suffer for 8-9 months. So what are they to do?
Right.
So, again, we don't do those modalities because that's contraindicative.
Yeah.
One of my tables is specifically designed for pregnant women for that said reason. And we do a lot of stretching because, there's an actual code called low back pain due to pregnancy because the anatomy, and there's some hormonal, chemical, physiological changes that are occurring in your last trimester of pregnancy, which is making your muscles lax.
And making the bones the joints more lax too.
Yeah, so
Preparing
that's
birth.
creating sciatica. So you'd be surprised. They're in their 20s and 30s and they're having severe sciatic pain due to the pregnancy. The cure is called delivery. But what can I do between now and then? I want to make them as comfortable because I'll say when Mama Bear's under duress, Baby Bear hears
Yeah,
it.
right.
So if we can lower the volume of this bad Milli Vanilli
And
song,
Papa Bear.
Yeah.
Papa Bear
Yeah.
hears it too.
Yeah.
yeah, Papa Bear has it too. Then they're okay, and you'll be so surprised how many pregnant. You find your niche, and we treat so many pregnant women in a very gentle manner, and again they feel better. And I'll see you in a week. They said no, I want to see. I'll see you in a month. No, so they know they're getting relief because they can't do anything because of the pregnancy.
Right.
So
Yeah.
in lieu of suffering again. If it makes you not feel better, but it's actually promoting a opportunity for the body to function better, then why wouldn't you seize that opportunity? And that's my mantra.
That's
It's
great.
like, if I can help you without hurting, then try it. Not for 6 months, not for 6 weeks, but try it at least to see if some good can happen.
How about kids? Do you see kids?
So, ironically, with this niche, I guess these backpacks are getting a little bit heavier these
Right,
days.
right.
I know
Yes.
with remote learning,
They're like
people,
40 pounds.
They are. So, a lot of pediatricians, you don't want kids on, they don't suggest medications for,
Right.
maybe it's a little bit of growing pain, maybe it's a little bit of sports injury, but I do treat a lot of young people, and the best part of it, they get better right away.
Yeah.
1 or 2
They
sessions.
bounce back a lot quicker than we do.
I don't even want to see them. They're so healthy. They bounce right back. Their parents are there during the interview,
Yeah.
during the examination. I'll explain what's going on. They're like rubber. They are so easy to treat, and they're so appreciative. So to answer your question, we do treat a lot of adolescents, and they get better.
But these backpacks are an issue, aren't they?
They are,
Potentially.
unfortunately, yeah. They are. I am seeing a lot of more middle school and more middle school than I ever have before. All of a sudden, there's a big influence pre-COVID, where they were having a lot of mid back pain and low back pain, and there's no pathology. It's just,
Right.
Strength.
you hold a bowling ball
Right.
that's 10 pounds. At some point, your shoulder is gonna
Yeah.
feel it.
Right.
So that's the
Right.
analogy I'll tell a patient. At some point, you got to drop that bowling ball to relieve your symptoms.
Raj, I got one more question for you too. These activators you hear about that chiropractors use, the little spring-loaded
Yeah,
thing. How does that work? Do you use that? And
I
what's it
use that a
do?
lot.
Explain
in a-
that. What is that?
It's so you can probably explain it better than I can. Actually.
So it's
An
a little
activator?
spring device that has force, very controlled force, so you control the amount of
What does
tension.
it look like?
Like a
pen
pen,
almost.
like a
Big
door
pen.
stopper.
Oh,
So, under precautions, if I have a geriatric patient with elements of osteoporosis, yeah, I'm not going to get aggressive adjustment on it.
right.
So we utilize this device. It's very gentle. It's very soft. It does evoke a little bit of movement. It does evoke a little bit of change. And maybe that's all we need to do to create that element of realignment. But guess what? I'm not hurting them. Or some that may have a severe disc pathology that has already tried or is momentarily under my care. I'm not going to do anything to aggravate that disc.
Right.
So maybe in those pretexts, I'll do some stretching and I'll use the activator to help them. Or maybe they're in a lot of pain where for the first few sessions, we're going to use the activator before we move on to more of aggressive. So I do use the activator. I use it on a lot of my patients. And maybe they are watching that YouTube video, and I'm very sensitive to that,
Yeah.
where, for now, if this is what gets you better, why not? Why not try something that may actually get some outcome, and it won't. If all I need, talking about malpractice insurance, if all I did was the activator, in theory, I wouldn't need any malpractice.
Right.
Yeah. But we do read reports, and you're held to that
Right,
responsibility.
right,
And
Yeah.
so forth
right.
and so. So it doesn't exempt me, but yes, they're very safe. Oh,
Nice.
in most parts, 100% safe. Yeah.
Nice.
Good.
So I think we're at our time
I
limit.
think so. I mean,
Wow,
this time-
okay.
This
I
time went
know,
by
it
very,
flew.
very,
Yeah,
very quickly.
well, I really appreciate the opportunity to kind of, just educate our community that, chiropractic is a viable, holistic approach to complement some of the other things that we're all doing.
Right.
When we talk about wellness, nutrition, behavior, exercise, sleep. Just get good sleep, and that's part of your recovery. Don't get in your fight with your spouse too often. That's part of your recovery. Don't fret the small
Did you
stuff.
hear that, John? You can't fight
Yeah,
with
can you
me.
talk to my wife about that?
Yeah. So all those things are, spokes of the wheel for wellness, for
that's
global
great.
health. Yeah.
That's
We've been
excellent.
fortunate. I have wonderful, friends, colleagues, and, people in our practice that really have the global goals.
Well, I must say you work very well with the medical community, which is great, and
appreciate
it's
that. Yeah.
it's not always that way with many modalities.
Yes.
So
yes,
that's
we should
that's
all work
wonderful.
together for the outcome of our patients.
Absolutely.
Yes.
So, how do we reach you? How's a patient
Right.
reach you?
Yeah, great. So we're on Ellsbury Street, which is right across the brand new, beautiful Durfee High School
In Fall River.
in Fall River, 415 Ellsbury Street. And my phone number is 508-676-7300. If you have any questions, if you have any concerns, maybe I can be a little bit of an instrument to help navigate an awareness of what other options you have to get you feeling for where you need to be.
Great.
Excellent.
I want to just once again recognize our sponsor, Bay Coast Bank. Just an awesome bank. Bay Coast is just right for all of your banking needs. And you can contact them through baycoastbank.com or call 508-678-7641. Dr. Nehra, this has been a great
Thank you
conversation
so much
on
for
chiropractic care.
inviting
Thank you,
me. I
Dr.
really
Nehra.
feel really
Thank
blessed
you.
to have this opportunity. Thank you both so
Yes,
very much.
thank you for
Thank
coming.
you.
And if
Yes.
anyone has any questions, you can post them on the on our Facebook page, and we'll get back and we'll get Dr. Nehra to answer those for you.
Absolutely.
So
I
thank
love
you
that
very much,
opportunity.
and we'll see you again in 2 weeks. Once again, this is the 27th Degree with Chris and Nancy, brought to you by 27 Degrees Consulting. Everyone have a great day. Thank you.